Namaste. I'm Dr. Rachna Kochariya, family physician and founder Doc Ginny Telemedicine. Today is World Hearing Day, and this is the reason we're going to talk about hearing loss in the elderly population, a population that I am very familiar with treating and managing over 26 years of my career. Why are we talking about the problem of hearing in the elderly? Well, scientific data suggests that over the age of 75 years, 50% of people will have some sort of hearing loss or another. And then over the age of 80, this progressively increases to most people, and over the age of 90, almost everyone. The reasons for experiencing hearing loss can be due to many causes, and broadly in medical science we call them conductive hearing loss or sensorineural. Sensorineural, the word for the elderly, is also used presbyocusis. But this cannot be assumed, and if you or a family member are noticing hearing loss, then it's very important to see your doctor or an ENT specialist to figure out what the cause of this hearing loss. In fact, studies are now showing that if hearing loss is there and not addressed in the elderly population, it can contribute to early dementia or cognitive decline. So this is another reason to address that hearing loss, besides many of the others that I've already mentioned. People ask me, how do you address this with stubborn family members, stubborn elderly in the family who do not want to go get this address? Well, I would suggest that think of something that they enjoy doing. That is important for them. It may not be a medical or a clinical reason, but if they enjoy the social afternoon, the occasional kitty party, or listening to certain things on television, and they're finding it harder to do so, then those are things that are important to them. So for these reasons, also maybe even staying independently. Many senior citizens want to function and live independently, where they're taking care of their daily activities, their medication, even cooking for themselves, all of this. So perhaps pointing out that to stay safely independent, hearing is one of the most important senses that they do need. I hope that with some of these tips, if you are suffering from any hearing issues or a family member is, you would get them seen at the earliest possible, or at least consult us for advice on www.docginny.in. Namaste.